Tim, so much. Good morning, all. I think it's still morning, maybe noon. Great to be with you, and great to be back at Heritage. Heritage does such a great job in so many areas, and healthcare, which is near and dear to my heart, is certainly one of those areas. Patient-centered healthcare, which is what the topic is, and how do we get patient-centered healthcare? It's important to think about what patient-centered healthcare is. What is it? What it means to me is that as a physician for over 25 years taking care of patients and families and doctors taking care and making medical decisions, not Washington, D.C., or not insurance companies. Patients and families and doctors ought to be the ones making medical decisions. The very troubling activity over the last 3 to 4 years is that what we've seen from the administration and what we've seen from Washington in so many corners is that we're moving away from, not even on the right trajectory, to get to patient-centered health care. We're moving away from allowing patients and families and doctors to make those medical decisions. Now, interestingly, I think that the conservatives have actually won the debate on the president's health care law and tax. I think we've won that debate. By overwhelming numbers, the American people say they don't like the patient's health care law and the taxes that go along with it. But they want a new solution, and that's what we're here to talk about today, positive solution. And they exist. They exist all across the Republican perspective. There are over 150 pieces of legislation, health care legislation, in the House of Representatives alone, 150. So when you hear the president say, if anybody's got a better idea, we'd like to sit down and talk about it. Well, the fact of the matter is we've asked the president over and over to sit down and talk about it, and he has refused at every single turn. I want to touch briefly on the principles of health care and then talk specifically about H.R. 2300, a bill that I've introduced now for the third Congress in a row. First, principles. What are the principles that we have and hold dear for health care? If you think about them, it's important that we follow those principles. You may think that you don't have health care principles, but everybody does. Everybody. Most people have the top three. We need a system that's accessible. Everybody needs to be able to get into the system. We need a system that's affordable. Everybody needs to be able to afford it in some way. And we need a system of the highest quality. Those are usually the top three: accessibility, affordability, and quality. I add three more to those. I add responsiveness. It doesn't do you any good to have a system where if you walk through the front door, nobody's behind the desk. That doesn't help anybody who's in need from a health care standpoint. Innovation. If we don't have innovation, if we don't incentivize innovation, then we don't have the highest quality. In fact, people are going to have to go elsewhere for the highest quality because we're stifling innovation. And then choices. The American people want choices and have a right to have choices in health care. Who's going to treat them, where they're going to be treated, how they're going to be treated, when they're going to be treated, all those kinds of things. So accessibility, affordability, quality, responsiveness, innovation, and choices. Those are the 6 principles that I believe we ought to make certain we adhere to. And regardless of what your principles are, I suggest that if you look at the president's law, that his law, current law of the land, violates every one of those principles. Decreasing accessibility, increasing costs, which means decreasing affordability. Quality, you talk to my medical colleagues, my former medical colleagues, they shudder because they're seeing a decrease in the quality of health care that's being provided. Not because doctors and other providers have forgotten how to care for patients, but because of the system is making it so quality is that much harder to be able to provide for individuals. Responsiveness, innovation, government health care, you decide. I don't think responsiveness and innovation tend to go in the same sentence as government run often, and in this instance they certainly don't. And then choices, fewer choices, and we hear about this day after day after day with the president's law. The choices are being limited, who you're going to be able to see, where you're going to be able to be treated. So if those are the principles, and we step back and you say, yes, that's what we agree on, those are the principles that we agree upon, then let's look to solutions that actually support those principles, adhere to those principles. H.R. 2300 is the bill that I mentioned that I've introduced now 3 Congresses in a row. There are packets, I think, in the back or in the right outside the room, and you're certainly welcome to pick them up. They describe the bill in some significant detail. H.R. 2300 is the work product of the Republican Study Committee 2 Congresses ago. So when the president was coming forth with his law, I was privileged to chair the Republican Study Committee at that time, and we got together about 20 or 25 people who had an interest in health care within the Republican Study Committee, many physicians, other folks who had been working in health care for a long time, and came up with our alternative at that time. It's been refined and I think perfected over the last two Congresses, but it does a number of things, and I want to touch on 3 or 4 specific things because it does the kinds of things that the President's law does not do. First, you got to get folks covered. You got to get folks to have that accessibility to care and to coverage and affordability of care, of coverage. How do you do that without putting Washington in charge? It's relatively simple. H.R. 2300 says that every single American ought to have the financial feasibility and incentive to purchase health coverage. You do that through the tax code, tax deductions, tax credits, refundable tax credits, advanceable refundable tax credits, so that every single American, regardless of their economic station whatsoever, have the financial ability to be and incentive to be able to purchase coverage, and it's coverage that they want for themselves and for their family, not that the government forces them to buy. No mandates. Remember, you as an individual, every single American knows best what kind of coverage they ought to have. There's no way the government can have a one-size-fits-all program because it fits nobody. One size fits nobody is what it turns out to be. So you can get everybody covered. Second, we've got to solve the insurance challenges. There are real insurance challenges that existed before the President's law. There are more coming online right now. But the 2 big ones are portability and pre-existing. You ought not lose your insurance if you change your job or you lose your job. That's a holdover from a bygone era when if you worked for a company, you usually were, and they provided health coverage, usually worked for them for 30 or 40 years, and you just kept your coverage. Young people in this audience, young people in this country right now, the statistics say that they will work for between 12 and 15 different employers in their lifetime. There's no reason whatsoever that they ought to have 12 to 15 different health care policies, health coverage policies, if they don't want. We ought not have a system that forces them. This is an easy one to solve. You simply allow every single American to own their coverage regardless of who's paying for it. So if you change your job, you lose your job, you just take it with it. Portability. It's like a 401k plan. You don't leave your pension plan at a previous employer, do you? No, you take it with you. Portability, easily solved. Pre-existing illness, this is one that is a real serious problem. Nobody in this country ought to be priced out of the market for health coverage if they get a bad diagnosis. That's a system that may work for government, it may work for insurance companies, it doesn't work for patients. Remember, patient-centered. If we think about the problem and diagnose the problem appropriately, we recognize that there are really about 18 million people who fall into that risk. If they have a bad diagnosis, then they may be priced out of the market tomorrow. Those are the folks in the individual and small group market. Those are the folks for whom they don't have a big pool. They don't have large groups of individuals assisting and purchasing coverage together, so they can't drive down the cost. How do you solve that without putting Washington in charge? You make it so those 18 million people look like the others for whom a pre-existing illness isn't a problem. That means that you create robust pooling mechanisms, not just high-risk pools, where you take all the folks with an illness or a difficult problem and you put them in one pool and you wonder why the price goes up. No, robust pooling mechanisms so that anybody who wants to pool with anybody else. We call them individual membership associations, so that you can purchase across state lines, you can join with others across state lines to be able to get that purchasing power of millions so that one individual's adverse health status doesn't drive up the cost for that person or anybody else. And then finally, we waste huge amounts of money in this country in health care. The biggest way that we do that is through what's called the practice of defensive medicine. As I mentioned, I was a physician. I was an orthopedic surgeon. I spent over 25 years taking care of patients. It's what I did. It's what every doctor does if he or she is honest with you. And it's the extra tests that are ordered and examinations that are ordered. And they're not done to harm you at all. But what they're done is solely so that if that doctor ever finds himself or herself in a court of law, that they can honestly look the judge and the jury in the eye and say, I don't know what you wanted me to do because, doggone it, I did everything. When, in fact, everything was rarely necessary to either diagnose or to treat the patient. Now, the standard line on the conservative side for how you take care of the lawsuit abuse in our country is a cap on non-economic damages. I'm here to tell you there's no study in this country that exists that demonstrates anything that a cap on non-economic damages decreases the practice of defensive medicine. How much does defensive medicine cost? There are a couple studies out there. Jackson Healthcare has a reputable study. estimates it's 1 out of every 3 health care dollars. That's $800 billion. $800 billion. That's not over a 10-year period of time, ladies and gentlemen. That's 1 year. That's every year. You add that up and see the amount the number of dollars that we are wasting in the area of health care. It's unconscionable. So what do we do if we make the right diagnosis, step back and look and see what the real problem is? You got to make it so that doctors, if they do the right thing, if they order the right tests and do the right thing as it relates to a patient, not because of what the Secretary of Health and Human Services said, but what scientists and their colleagues in that specialty society say, based upon appropriate guidelines. If they do the right thing, they ought to have a safe harbor, essentially, in a court of law. They ought to be able to use that as an affirmative defense, to go into the court and say, I did exactly what I should have done as it relates to the problem that this patient presented to me. If you use that as an affirmative defense and you raise the bar, you raise it to clear and convincing evidence instead of a preponderance of the evidence, then what you do is begin to chip away at that culture of the practice of defensive medicine. Remember, wasting $800 billion a year. So look what we've done. H.R. 2300 gets everybody covered with insurance that they want, not that the government forces them to buy, solves the insurance challenges of portability and pre-existing without putting Washington in charge, and saves hundreds of billions of dollars, all without putting Washington in charge or raising your taxes by 1 penny. 1 penny. And the solutions that are in H.R. 2300 are included in a number of other pieces of legislation. There's a lot more that we have in common than not. What we don't have in common with the current law of the land, though, is that we stick to principle. We stick to the principles of affordability, accessibility, quality, responsiveness, innovation, and choices. If we do that, I have great faith and confidence that what we will ultimately end up with in this country is a system that is truly patient-centered, where patients and families and doctors are making medical decisions, not Washington, D.C. Thank you so much.